I'm from Duke-NUS Medical School, and I would like to thank Lou this morning for the very nice and kind introduction on IL11, because it is a relatively little studied cytokine, so, well, thank you for the wonderful introduction on it, even though it's a member of IL-6 family, which is very famous. So, IL11 is misinterpreted in the earlier literature. Despite what people would tell you in the earlier years, it is actually pro-fibrotic in fibroblasts and also in epithelial cells. It is anti-regenerative across organs. We have seen it in the liver, kidney, and lung. And it's also pro-inflammatory, particularly in the stromal and epithelium, and which actually play an important role in inflammation, even though they are not inflammatory cells. When we first studied IL11, we were aware that it could signal through its canonical JAK-STAT3 pathway. This is IL11 binding to its receptor, signaling via GP130 to activate STAT3. At that time, we know for a little bit that it could also signal through ERK. But what we have come to understand in a more detailed fashion over the last few years is that in this pathway, the ERK phosphorylate P90 risk, which both of them, and then phosphorylate LKB1 to inactivate it, which can then activate AMPK, causing its inactivation, activate mTOR and its downstream mTOR substrate. So why is this important in aging? Well, some of the key important pathways or components that people like to target in aging are ERK, LKB1 AMPK, and obviously mTOR being the key target here, and probably one of the best aging pathway that people study in healthspan and lifespan. So now, if I overlay the IL11 signaling for you, you can see why this is relevant, because IL11 is controlling these key aging components. Which brings us the question, could IL11 itself be an important aging factor, particularly inflammaging? In order to be important for aging, your activity and expression have to be regulated with aging. So this is Western blot from liver extract from mice, which are 12, 25, 50, 75, and 110 weeks of age. And what we've simply done here is to plot for IL11. As you can see, as mice age, as they hit about 50 weeks of age, we begin to detect upregulation of IL11 expression, and this is progressive as those mice age. And if you see downstream of that, you see an increase in ERK phosphorylation, increase in P90 risk phosphorylation, phosphorylation of LKB1, which inactivates it, dephosphorylation of AMPK, and consequential increase in the activation of mTOR and downstream mTOR substrate. And so this is correlative. IL11 is going up with aging, and you see corresponding activation of this pathway in the liver and all other organs that we have tested to date, including kidney, brain, thymus, skeletal muscle, fat, and so on. And this observation holds true in male and female mice. So that's for correlative relationship. How about mechanistic relationship? So this is young and old mice from wild type and IL11 knockouts. If we just focus on the old mice here, if we take away IL11, you will inhibit ERK, you inhibit P90 risk, you rescue the activity of LKB1 and AMPK, you inhibit mTOR and its downstream substrate phosphorylation, and you also reduce the expression of senescence markers. So this suggests that IL11 upregulation in aging is associated with corresponding activation of this pathway, and it's also associated with senescence. So next, we began to look into health span and features that are associated with aging. For example, here we are looking into adiposity. So as you can see that we have young and old mice from wild type shown in black and IL11 knockouts shown in orange. As mice age, they have an increase in fat mass. And as you can see that the wild type mice become fatter, but this increase in adiposity is reduced in IL11 knockouts. Here is lean muscle mass, which is reduced in all wild type, but we have retention of this lean muscle mass in the knockouts. So IL11 knockouts are not only getting less fat, but they are also retaining their muscle mass. How about the fat weight itself? This is the weight of visceral white adipose tissue. Wild-type mice put on a lot of fat as they age, but you see a lot less of that in the knockouts. And this is also true for subcutaneous fat. So this suggests that the loss of function of IL11 signaling prevents the onset of aging-associated adiposity. So that's for the knockout. We next perform therapeutic intervention study where we assess MALT health span across the age of 75 to 100 weeks of age. In this experiment, we divided the mice into 3 groups. The first group received no intervention, the second group received IgG, and the third group received a neutralizing monoclonal antibody that can specifically block IL-11, which we refer to as anti-IL-11. And this is what happened to these mice. We just focus on the blue line here. This is for the mice getting anti-IL-11. They actually lose weight. They lose about 15% of their starting body weight, even though they eat more. This is the weight of the visceral white adipose tissue. 75-week-old mice, they have this much fat. 100-week with no intervention, this much. With IgG, similar. But with anti...
Wrong button.
Did I press something?
All right, thank you so much for ARDD. That's enough.
Did I press something wrong?
That was a technical glitch.
Okay.
Your talk was so good that it blew all the fuses. So, thank you so much. We're restarting, and it will be just a minute.
Maybe questions?
Yeah. Any questions so far? We have a question here.
Yeah,
Yes.
maybe it would be great if you can tell us a little bit about the story of, how did you come up with IL11 and how did the paper got published? Because Stuart presented 2 years ago, right?
Yeah, so we first found
Here at this
IL11.
conference.
Yeah.
And you probably saw his talk.
Oh, well. Well, yeah, so when we first found IL11 as a very strong pro-fibrotic factor, and we published that also in Nature in 2017. And around that time, we also realized when we tested our antibody in the rat, it just so happened that our rat samples are across different ages, and this is when we came to study aging. And because we realized that IL11 levels get upregulated as they age.
Fantastic. So
Okay, let me
please make sure
continue.
that your talk is not quite as good, almost as good. No. Thank you so much. Let's give her a round of applause so far.
Thank you, everyone. So yes, as I mentioned, at 75-week and 100-week, they have about similar amount of visceral white adipose tissue, but with anti-IL11, we have reduction in the weight of white adipose tissue. This is gastrocnemius skeletal muscle mass. At 75-week-old, you have this much muscle. The mice lose muscle at 100-week with no intervention and with IgG, but with anti-IL11, the loss of muscle mass is less apparent. This is full body grip strength data. The muscle strength is pretty similar between 75-week and 100-week with no intervention and IgG, but with anti-IL11, you are actually getting an improvement. The muscles become stronger. So these are frailty scores. The gray dots represent the frailty scores at the start of the study, which is pretty similar across 3 different groups. The mice become more frail with no intervention. The mice also progress to be more frail with IgG, but with anti-IL11, there is no progression in their frailty. And in fact, some of them are going the other way, which means that the mice become less frail at the end of the study as compared to before they started their therapy. And these lower frailty scores are driven by a range of improvements in kyphosis, gait disorders, vestibular disturbance, tremor, and coat appearance, to name a few. This is the epigenetic clock data. We have to take it out from the publication as a per reviewer request. But because we outsourced this to a company called Zymo, and they performed this experiment, the caveat is the highest value in their standard curve is 80 weeks of age. But our mice are actually 100 weeks. Nevertheless, based on this assay, we found that the liver and gastrocnemius from the mice getting anti-IL11 are significantly younger, with the liver about 50 weeks younger, and the gastrocnemius about 30 to 40 weeks younger as compared to those organs from mice getting IgG by this assay. Just a little bit here to end about IL-11 signaling in adipose tissue. So the loss of white adipose tissue beiging or browning is an aging phenotype in humans and mice. And beige fat is where we are burning our calorie and keeping our weights off. If we profile adipose tissue or fats from mice getting IgG, you have undetectable expression of UCP1, which is a marker for white adipose tissue browning. If you profile the fats from mice getting anti-IL11, you have large upregulation of UCP1 and also the expression of genes that are known to be important as a marker for white adipose tissue browning. So what actually happened in these mice getting anti-IL11 is that you have reactivation of this age-repressed program of white adipose tissue browning or beiging, which is a process that is metabolically very beneficial. So that's for healthspan. How about lifespan? This is still an ongoing experiment because it's not done yet, at least for the anti-IL11 group, because some of the mice are still alive, but the experiment is done for the IgG because all the mice are dead. So based on our preliminary data, it seems to show that inhibition of IL11 later in life prolonged lifespan in mice with median lifespan extended by about 20 to 25% in both sexes. So these are some of the favorite pathways that people in the aging field like to target. And as Prof. Luke Silo, I'm sorry if I mentioned her name wrongly, but she said that everything good can be improved. These are all good, these all work, but everything good can be improved. So we would argue that anti-IL11 will give you combination therapy because it inhibits ERK, it rescues the activity of AMPK, it inhibits mTOR, and it also reduces senescence. We believe that anti-IL11 should have a good safety profile with very limited on-target toxicity because it only inhibits pathways that are downstream of IL11. So you still have normal ERK and normal mTOR, they are still possible. Just a little segue for my next speaker. I think she will speak about PD-L1. I just want to say that IL11 is a strong inducer of PD-L1. And actually one of the company that is now running phase 1 clinical safety trial for anti-IL11, one of the intent of this company is to develop a combination therapy for anti-IL11 and anti-PD-L1 for the purpose of cancer immunotherapy. To conclude, these mice are sisters. They are both of the same age, about 2-year-old, because they are litter mates. Wild type on the right, and IL11 knockouts on the left. And as you can see, the knockout sister, she appears leaner with better coat appearance. And this is the list of phenotypes that we observe with inhibition of IL11, both in the knockouts and with anti-IL11 therapies. And with that, I'll stop, and I'll be happy to take questions. Thank you very much for your attention.
Thank you very much for a very interesting talk. We have time for a question.
What are the functions for which evolution selected IL-11, please?
Yeah, so IL-11 is important for development, even though the effect is mild and incompletely penetrant. So individuals who do not have IL-11 in their body, they actually exist in the general populations. They appear well and normal, but they might have, the keyword here is might, they might have craniosynostosis, which is an early fusion of the skull. They might have mild joint flexibility, delayed tooth eruption, maxillary disorder, and conductive disorder of the ear. But the effects are mild and incompletely penetrant.
So questions here. I think that Boehringer Ingelheim has an anti-IL11 antibody in human clinical trials right now.
Yes.
How are they collaborating with you? And do you know if they are going to do any aging clocks? Are they interested in aging?
Yeah, so they acquire our patents actually, and their intent is to develop anti-IL11 therapies for IPF and NASH. They have not expressed any interest in aging yet, but hopefully with this publication, it can push them in that direction.
Good job. By the way, round of applause. They sold a drug already, so that's a big thing.
Thank you, everyone.
Thank you.